Between 1/4 and 1/2 of individuals older than 65 years of age residing on the territory of Western Balkans has a need for long-term care due to greater difficulties in their daily functioning. The greatest number of individuals with such needs arise in Bosnia Herzegovina, while the least in North Macedonia. These are the results of a research on long-term care service access conducted on a sample of more than 3,900 individuals in Serbia, Albania, Bosnia Herzegovina, North Macedonia, Montenegro, and Kosovo. Among individuals in need of long-term care, more women than men have greater difficulties in performing everyday activities. This is especially the case in Montenegro, Serbia, and Albania. When it comes to individuals with disabilities ages 18 to 64, the percentage of those with great difficulties in performing everyday activities ranges from 2/3 in Serbia and North Macedonia all the way up to 98% in Albania. Formal long-term care services are provided through healthcare and social welfare systems, but they are not harmonized. On the entire territory in question, the healthcare system has a long-standing tradition. It is centralized and standardized. Services within the social welfare system are not uniform. Somewhere there is more of them, somewhere less. Some places they are implemented at the state and other places at the local level. And they mostly refer to wider social groups than the over 65s and people with disabilities. With regards to formal long-term care services, the following types are mostly present on the Western Balkans territory: residential services, family accommodation, and home care services. The capacity of residential institutions is at a low level in the entire region, but the interest is also extremely low. In some places, it is even lower than 10%. As the most common reason why they do not consider residential institution replacement in Serbia, Montenegro, North Macedonia, and Kosovo, they state that they simply don't want to live in such a place. In Bosnia Herzegovina, the main reason is because it is expensive, and in Albania, because they don't want to live separately from their families. The majority of individuals in the region over the age of 65 rarely think about family accommodation. The largest percentage would accept this possibility in North Macedonia and the least in Montenegro. Individuals with disabilities ages 18 to 64 share similar opinions. The interest is the greatest for home assistance services, but these services are not present to a great degree. The reason is a lack of sufficiently trained staff, but also a lack of funds. These services are mainly provided by non-governmental and humanitarian organizations, while private sector services are generally unattainable due to limited financial resources. In most cases, elderly people and people with disabilities rely on the support of informal caregivers, who are usually the closest family members, spouse, children, parents. Women generally rely more on support from their children compared to men, and men rely more on spousal support compared to women. In most cases, people who need long-term care do not receive compensation from the state for assisted living, and most of them stated that even their informal caregivers do not receive expert advice on providing care from line state institutions or non-governmental and humanitarian organizations. In the Western Balkans region, the average life expectancy is 76.28 years, while the disease-free life expectancy is 67.26 years. The difference of 9.02 years is the period of life in which the need for long-term care services becomes regular. Therefore, the following should be done: integration of healthcare and social welfare systems, increase the scope of long-term care services, ensure a higher number of trained caregivers, provide better conditions for informal caregivers, and regulate the private market of long-term care services. Investing in long-term care will improve the quality of life for individuals in need of care and provide an opportunity for informal caregivers to re-enter or remain in the labor market.